So how do you support your body? First off, what is letrozole? Okay, letrozole is also called Femara. In the States, we typically hear Femara being used. Here in Canada, we call it letrozole. It's the same thing. Okay, so if your clinic has recommended Femara, know that that is letrozole. And common dosing being 2.5 milligrams, 5 milligrams, 7.5 milligrams. I have seen 10 milligrams being used many, many, many years ago, but not in a very long time. So average dosing being about 5 milligrams, right in the middle there. Clinics typically do like just start at 2.5 for most women. Obviously, lowest dose is always going to be better, right? Less side effect potential, less lining impact potential. And if it works at 2.5, fantastic. But oftentimes women maybe don't respond as well as we want them to at 2.5 and do have to move up to 5. And some clinics honestly still start at 5 these days. So it depends. Either of those are perfectly fine options. And you're going to take this starting cycle day 3 for 5 days. That's pretty standard. I have seen clinics adjust the dosing schedule ever so slightly, and that's okay. But the idea is to lower estrogen in that early follicular phase of your cycle to ramp up FSH production, pull more follicles, hopefully have more than one dominant follicle, but help to mature the follicles that are there. So if we wait too long, we're not going to get that same process, that same benefit. So early on, typically starting cycle day 3 is when we want that letrozole dosing to happen. Letrozole is what's called an aromatase inhibitor. So aromatase is an enzyme in the body that converts androgens, testosterone, into estrogen. This is a normal process. All of our bodies do it. We want it to do it at a certain amount, right? We don't want aromatase to be working too hard, and we don't want it to be not working at all. We have that sweet spot. So what an aromatase inhibitor comes in and does is it blocks that aromatase enzyme for those 5 days that you're taking the letrozole. So less testosterone is being converted to estrogen. So you're not necessarily producing less estrogen. You are converting to less estrogen. So you are lowering your estrogen in your body in a slightly different way than Clomid does, for example. Those two drugs do the same thing. Less estrogen equals more FSH, but in a different way. And so the way in which letrozole does it is by actually stopping the conversion of your androgens into estrogen. Therefore, we have an overall lowering of estrogen in your body that tells your pituitary that we need more FSH, FSH being that follicle-stimulating hormone. So the premise being, could we get more follicles? Could we have 2 or 3 eggs become dominant, mature, and release? Or maybe it's still only 1, but it's maturing, it's getting a bit bigger, it's having a better, follicular response before ovulation happens.